Welcome to another episode from the Veterinary Research Channel. Today we are diving into a retrospective study that looks at relapse risk factors for immune-mediated hemolytic anemia, or IMHA, in dogs. This research, conducted by Sydney Bannister, Deborah Keyes, and Ewan Wolfe, aims to identify factors that could help clinicians better monitor and treat dogs susceptible to relapses of this autoimmune disease. Immune-mediated hemolytic anemia in dogs is characterized by the immune system destroying red blood cells. This condition carries a high mortality rate, ranging from 24 to 58%, and can be a significant financial burden for pet owners. While relapses are a known complication, the specific risk factors that contribute to these relapses have not been well defined. The study hypothesizes that certain initial indicators, such as a lower packed cell volume, the need for multiple transfusions, or elevated total bilirubin levels, could be associated with a higher risk of relapse. The study reviewed the records of 163 dogs diagnosed with IMHA between January 2005 and December 2019. The diagnosis of IMHA was based on a packed cell volume of less than 30%, combined with at least two of the following indicators: the presence of spherocytes, a positive Coombs test, elevated total bilirubin, hemoglobinemia, or positive slide agglutination. The researchers excluded cases where anemia was due to other causes such as trauma, chronic disease, liver issues, or kidney disease. They also excluded associative IMHA cases linked to infections like Babesia, neoplasia, drug reactions, and precursor IMHA. For the purpose of this study, a relapse was defined as a decrease in packed cell volume of greater than 10% from a previously documented level above 30%, occurring more than 1 month after the initial diagnosis and not associated with trauma, surgery, or neoplasia. This definition helped to distinguish true relapses from cases where the initial treatment was ineffective. The study found that 7.9% of the dogs experienced a relapse. The probability of relapse was 5% within 3 months and 11% within 1 year. Interestingly, the need for 2 or more transfusions showed a notable association with relapse. Dogs that required 2 or more transfusions had a 20% probability of relapsing within 1 year, compared to only 7% for those who did not. However, statistical analysis did not confirm a significant association between the number of transfusions and relapse risk. The initial hypothesis regarding lower packed cell volume at diagnosis as a risk factor for relapse was not supported by the data. However, the study did find a significant association between higher total bilirubin levels and an increased risk of relapse. For every 1 milligram per deciliter increase in total bilirubin, the probability of relapse increased by 0.17. This suggests that dogs presenting with higher bilirubin levels may require more intensive monitoring. The finding that elevated total bilirubin is associated with a higher relapse risk suggests several possibilities. It could indicate a more aggressive form of the disease, an inadequate response to immunosuppressant medications, faster hemolysis, or delays in seeking medical intervention. The study also explored why the number of transfusions, initially thought to be a significant factor, did not show a strong statistical correlation with relapse. The number of transfusions was determined by the number of packed red blood cell units purchased, and larger dogs might require more transfusions due to their size. The lack of consistent recording of cross-matching results made it difficult to assess the impact of transfusion compatibility. Additionally, factors such as whether a patient was receiving a transfusion for the first time were not considered, but could influence the outcomes. Typical treatment regimens for IMHA involve prednisone or prednisolone, along with another immunosuppressant such as cyclosporin, mycophenolate mofetil, azathioprine, or leflunomide. However, the study acknowledges that owner compliance with medication schedules and follow-up appointments could significantly affect relapse rates. This aspect, unfortunately, was difficult to assess in a retrospective study. While previous research has suggested that female dogs are more prone to IMHA and other immune-mediated diseases, this study did not find a significant sex predisposition for relapse. The probability of relapse was actually lower in spayed females compared to castrated males, possibly due to the removal of hormonal influences. Older age at diagnosis was also considered as a potential risk factor, given that older dogs are more likely to have concurrent health issues. However, age was not found to be significantly associated with relapse risk. The study identified Cocker Spaniels and Dachshunds as commonly affected breeds, consistent with earlier studies. Chihuahuas were also frequently affected, which is a new finding. However, the number of relapses within each breed was too small to determine any breed-specific predisposition for relapse. Several limitations of this study should be considered. The retrospective design and the high number of patients lost to follow-up could have skewed the results. Financial constraints might have led some owners to seek follow-up care with their primary veterinarians, rather than returning to the specialty clinic. The wide time frame of the study also meant that changes in treatment protocols over the years could have influenced the outcomes. The relatively small number of relapses observed limited the statistical power of the analysis, potentially leading to type 2 errors. Despite these limitations, this study contributes valuable insights into IMHA, particularly in cases of relapse. The finding that higher total bilirubin levels at diagnosis are associated with increased relapse risk is particularly significant. Identifying dogs at higher risk of relapse can lead to improved client education, more realistic long-term prognosis, and more effective monitoring strategies. Further research is needed to explore potential early warning signs and develop more targeted therapeutic interventions. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.